Okay, so studying for this physio exam, sometimes, I don't know about you, but it feels like I'm just building this house of cards, and then the second I think about it too hard, poof, it's gone. It's like I can memorize that paraffin wax needs to be at a certain temperature, but if someone asked me why it matters, I'd be lost.
You're so right. It's all about understanding the why. And that's what makes those 100 MCQs you sent over so useful for our deep dives today. It's
Yeah.
not just about memorizing the right answer. It's about getting those connections, making the information actually stick.
Yes, I am so ready to dive into these. And speaking of foundations, I gotta say, one MCQ I found really threw me off. It talked about 5 fundamental positions in physiotherapy. I always thought it was just 3, standing, sitting, lying down.
You're not the only one. But remember, we've also got kneeling and hanging in our physiotherapy world. And they're not just there for fun. They each have a purpose.
A purpose. Okay, I'm intrigued. Tell me more.
Well, each position, it changes how gravity affects the patient, right?
Hmm.
And that changes the muscles being used, the range of motion. It's like, imagine someone's doing a bicep curl. If they're standing, it's one thing, but have them kneel.
Mm.
Suddenly, different muscles are working harder, stabilizing. So we can use these positions strategically, to target certain areas, make an exercise harder or easier, all sorts of things.
Whoa, so we're like puppet masters, but instead of strings, we're using physics. That is way cooler than just memorizing 5 positions. But it's not just about where the body is, right? There's also what the muscles are doing. And these MCQs definitely reminded me I need a refresher on concentric versus eccentric contractions.
And lucky for you, you sent over the perfect example kicking a soccer ball. So when you pull your leg back to kick, your quadriceps muscle is actually lengthening while it's working. That's eccentric contraction. But then, bam, you kick, the quadriceps shortens, generating power, that's your concentric.
Okay, yeah, that makes it way more clear. It's easier to remember when you can picture it happening.
Exactly. And that difference, concentric versus eccentric, that's essential for everything we do, strengthening, rehab, everything.
Because if you don't know how the muscle's working, how can you treat it properly?
Exactly. And speaking of how things work, I saw a treatment in these MCQs that always reminds me of Star Trek Frankel's exercises.
Frankel's exercises. Rings a bell, but I'm blanking on what exactly they are.
It's a really cool approach for treating ataxia, which is that loss of muscle control. So picture someone, they're struggling to move smoothly, right? With Frankel's, the therapist uses a mix of sight, sound, touch to guide those movements.
Like retraining the brain to talk to the body again? Are we talking high-tech gadgets here?
Nope. No fancy equipment needed, although it sounds like it. It's carefully designed exercises, repetition, that kind of thing. Like the therapist might move the patient's hand across different textures while giving them verbal cues, helping the brain rewire those connections.
That's wild. It really shows how physiotherapy is so much more than just treating the symptoms. It's about the whole nervous system, too.
You got it. And since we're talking nervous system, there was another MCQ that caught my eye. It dealt with iontophoresis.
Ooh, iontophoresis. I always mix that up with other electrotherapy treatments. Remind me what makes it unique again.
So it uses a low-level electric current, but the key is it delivers medication directly through the skin.
Wait, so instead of a pill or injection, it's like a tiny targeted dose of medicine right where you need it. That's incredible. But are there any downsides, side effects we need to watch out for?
Definitely a good question. Like any treatment, there are considerations. Skin irritation is one, and we have to make sure the medication itself is a good fit for this kind of delivery. So it's all about weighing those risks and benefits.
Makes sense. Now, speaking of things to consider, this next MCQ I came across, it brought to mind a really important acronym, the Police E principle.
And just to clarify, we're not talking law enforcement here.
Haha. Right. Though I wouldn't mind a police escort to get me through this exam. But seriously, what does police stand for again?
Protection, optimal loading, ice, compression, and elevation. It's like your 5-step plan after a muscle or joint injury, especially in those early stages.
Ah, yes. It's a mental checklist. Did we do everything to minimize damage and help the healing process?
Exactly. And we've talked about a lot of individual techniques, but how do they all come together in practice? Why don't we dive into those case study MCQs you shared, see how it all plays out in the real world?
Oh, I'm so ready for those case studies. You know, one thing that always trips me up is gait analysis. Like, I get the basics, but then those MCQs throw in a curveball asking what happens when specific muscles are weak.
Yeah, it's one thing to recognize a normal gait pattern, but understanding those deviations, that's where the real detective work begins. So which MCQ had you stumped?
Well, there was one about Trendelenburg gait, which I always mix up with, well, everything else.
Trendelenburg. It's a classic sign of weakness in those hip abductor muscles, especially the gluteus medius. Picture this. Someone's walking, and as they step, their hip kind of dips down on the opposite side.
Right. It's subtle but noticeable, like their body is trying to compensate for something.
Exactly. And that something is usually that weakened gluteus medius muscle.
Yeah.
It's amazing how much we can tell just by observing someone's walk, right?
It's like the body whispering its secrets, and we have to learn how to listen. Speaking of secrets, there was that case study on Purform Syndrome. That one always throws me for a loop.
Piriformis syndrome, a real pain in the, well, It's all about this deep buttock muscle, the piriformis, and its troublesome relationship with the sciatic nerve.
Okay, yeah, the sciatic nerve, that's the one that runs down the back of the leg, right?
That's the one. And the problem is the piriformis muscle is right next door. So if that muscle gets tight or inflamed, it can actually pinch or irritate the sciatic nerve.
So someone might come in with what seems like classic sciatica symptoms, pain, numbness, tingling down the leg, but it's actually this piriformis muscle acting up.
You got it. It's a perfect example of why understanding anatomy isn't just about memorizing muscle names. We need to know their location, their relationships to other structures. It's like a 3D puzzle in there.
And sometimes those puzzle pieces like to play tricks on us. Okay, so we've tackled Trendelenburg gait, piriformis syndrome. What other cases did those MCQs challenge us with?
Well, one that comes to mind, and this one's a big one, is brachial plexus injuries.
Oh, don't even get me started on the brachial plexus. That's like a whole other language I haven't quite mastered yet.
It's definitely complex, but let's break it down. Imagine the brachial plexus like this intricate network of nerves that controls your entire arm from your shoulder down to your fingertips.
Okay, I'm picturing a network, like a web of nerves.
Now, the MCQs you shared focused on differentiating between upper and lower brachial plexus injury.
Right. And I always mix those up.
Well, think of it this way. An upper brachial plexus injury, sometimes called Erb's palsy, often happens from a forceful pull during birth or a hard fall where the head and shoulder are jerked apart. It's those upper nerves that take the hit.
Ouch. So what does that look like in a patient?
You'd likely see weakness or even paralysis in the shoulder and upper arm muscles because those upper nerves control things like your biceps, your deltoids, your rotator cuff.
Ah, okay. So what about the lower brachial plexus injuries?
Those often happen with a hard downward pull on the arm, like if someone reaches out to break a fall. We call that Klumpke's palsy. And because it's the lower nerves, you're more likely to see problems with the hand and forearm muscles.
So upper brachial plexus, trouble with the shoulder and arm. Lower brachial plexus, look out for problems with the hand and forearm. Got it.
Exactly. And that distinction, upper versus lower, is crucial because it helps guide our assessment, treatment, the whole 9 yards.
Yeah.
We need to know which nerves are affected to target our approach effectively.
It's like you can't fix a car if you don't know which part is broken, right?
And speaking of fixing things, I think it's time we zoom out a bit. We've covered so many specific conditions and techniques, but how does it all fit into the big picture of physiotherapy? You know, going through these MCQs, it really hits home that it's not just about knowing the names and definitions. It's about connecting the dots, seeing how it all plays out in a real person.
Absolutely. We can talk about Trendelenburg gait and piriformis syndrome all day long, but it's those aha moments in the clinic when you connect the theory to a real patient that the learning really clicks. It's like we've been building this incredible toolbox of knowledge, and now we're finally getting to use it.
Exactly. And the more you use those tools, the sharper they get. Every patient interaction, every assessment, every treatment plan, it all refines your skills and deepens your understanding.
It's like that saying, practice makes perfect. But in our field, it's not just about perfection, is it? It's about using our knowledge and experience to help people live better, healthier lives.
You said it. And speaking of applying our knowledge, something we haven't touched on yet is how these principles translate to athletes. That's a whole other layer of complexity.
Oh, for sure. Every sport has unique demands, different muscle groups that take center stage. A marathon runner is a totally different animal than a power lifter, right?
Exactly. Their training, their risk of injuries, even their nutritional needs are worlds apart. So how would you take everything we've discussed today, all these assessment techniques, treatment modalities, and tailor them for an athlete in a specific sport?
Whoa. Now that is a question to ponder. It's like taking this incredible foundation we've built and customizing it for peak performance in any arena.
That's the exciting part. And it's a journey, you know? You never stop learning, never stop refining your approach in this field.
That's what makes it so rewarding, right? Well, I don't know about you, but my brain is officially buzzing after this deep dive.
Mine too. And remember, to all our listeners out there, this is just the beginning. Keep those brains buzzing, keep asking why, and keep exploring the amazing world of physiotherapy.
Couldn't have said it better myself. Until next time, everyone, keep those bodies moving and those minds engaged.